Welcome to the e-learning module on pathology of nutritional anemia. This session is on normal hematopoiesis and normal constituents of the bone marrow. So the learning objectives are: end of the session, students should be able to describe normal hematopoiesis, the constituents of the blood and the bone marrow. So what is normal hematopoiesis? Hematopoiesis is a physiological process of formation of the blood cells. So what are these blood cells? Blood cells are red cells, WBCs and platelets. So WBCs has granulocytes like neutrophil, eosinophils and basophils, and lymphocytes and monocytes. So formation of all these cells are called as hematopoiesis. So what are hematopoietic organs? So these organs are the site where these hematopoietic cells are produced. So it starts in the beginning of few weeks after the gestation. So initially it starts with yolk sac. So first few weeks of gestation, that is in the embryo, it is the yolk sac is the main site of hematopoiesis. By around third month of intrauterine life, liver and spleen start synthesizing these cells. And this site continues until about 2 weeks after the birth, mainly the liver. So by fourth and fifth month of this of gestation, this starts in the bone marrow and it becomes fully active by seventh and eighth month of intrauterine gestation. And at birth, practically all the bone which is there in the body will contain the active marrow. So in childhood, there is progressive replacement of this bone marrow by the fatty tissue. So by adult life, the hematopoietic marrow will be confined to the central skeletal only. So these are skeletal system includes vertebrae, sternum, ribs, skull, sacrum and pelvis and few end of the long bone. So as you can see here, in the prenatal period, the hematopoiesis begins in yolk sac, followed by spleen and liver. So by birth, there is little bit of hematopoiesis taking place in the liver and the spleen also. But by around third month, there is beginning of hematopoiesis in the bone marrow, which continues even after the birth. So these are the sites of hematopoiesis in adults. So it is mainly in the central skeleton like skull, ribs, sacrum, pelvis, and end of the long bones like tibia, femur, and humerus. Sternum is also site of hematopoiesis in the marrow. So bone marrow, as it is the site of synthesis of these cells, they will lead to proliferation, differentiation, and release of the most mature blood cells. So what are the things which are seen in the marrow? So it has bone, it has network of thin-walled sinusoid, which are blood vessels, lined by single layer of endothelial cells. So in between there is a interstitium, which is a stroma, which will be having fatty tissue and also hematopoietic cells, which are seen in clusters. So differentiated blood cells will enter the circulation by transcellular migration through the endothelial cells, which is lining the network of these sinusoids. So this is the picture of bone marrow, which is active in hematopoiesis. So it has a trabeculae. So this is a cancellous bone. So this is having the trabeculae, and in between there is fatty tissue, and in between the fatty tissue there is marrow element. So in adults, almost both marrow and the fatty marrow and hematopoietic tissue will correspond to 50% each. So how does this hematopoiesis takes place? So it begins from hematopoietic stem cells, which are most immature cells seen in the bone marrow. So they get differentiated into multipotent progenitor, followed by early progenitor, and followed by colony forming units. So colony forming units are a specific lineage of cells which will lead to specific type of WBC or RBC or platelet. So as you can see here, so hematopoiesis in the marrow begins with hematopoietic stem cells. So they get differentiated into multipotent progenitor, then leading to the progenitor with the lymphoid potential and myeloid potential. Lymphoid potential cell will undergo differentiation into natural killer cell, B cell, and T cell. So it will form from early progenitor to pro B or T or NK cell, followed by pre cell, followed by the most mature cells. Whereas the progenitor with myeloid potential, they can differentiate into granulocytes and monocyte, platelets, and erythrocyte. So after the early progenitor with the myeloid potential, there will be formation of colony forming units. So colony forming units are specific for each type of differentiated cell. So we have CFU, that is colony forming units for granulocyte, which will give rise to maturation into the neutrophil. CFU M, which will lead to synthesis of the monocyte. CFU-E, eosinophil, which will lead to formation of eosinophil. CFU-B leads to basophil. CFU-MG, nothing but megakaryocyte, which will lead to platelet formation. E, which is erythroid series precursor, which will lead to formation of the erythrocyte, nothing but RBCs. So how these production of hematopoietic cells are regulated? So there are growth factors which are called as hematopoietic growth factor or colony stimulating factor. So the example for these growth factors are erythropoietin, which will lead to production of the RBC, thrombopoietin leads to production of the platelet, GCSF or GMCSF, that is granulocyte macrophage CSF. This will lead to formation of granulocyte like eosinophil, basophil, and monocyte, and this will lead to production of neutrophils. So these are the growth factors. So coming to the process of production of these mature blood cells. So the first is RBCs, nothing but red blood cells, erythrocyte. So it begins from the most immature erythroid precursor, which is called as proerythroblast. So proerythroblast is the first step in the erythropoiesis. So proerythroblast is a type of blast which will have nucleoli, open chromatin, high NC ratio with basophilic cytoplasm. So second step is basophilic or early erythroblast. So here we will have a more condensed chromatin compared to proerythroblast, and it will have deep basophilic cytoplasm. Next step is polychromatic erythroblast or intermediate erythroblast. So this is the step where the mitosis division will stop, and also the beginning of hemoglobinization of the cytoplasm will start in this step, that is intermediate or polychromatic. So the term polychromatic because there is production of the hemoglobin which is leading to a red tinge to the bluish cytoplasm. Next step is orthochromatic erythroblast. So ortho means single. So here it is predominantly hemoglobin which is there in the cytoplasm, and very much condensation of the nucleus we can see in this step. Followed by reticulocyte. So reticulocyte doesn't have nucleus. So nucleus will be extruded from the cytoplasm in late erythroblast stage. So that is followed by reticulocyte. So reticulocyte are little bluish thin cell because they have ribosomal RNA. So they spend around 2 days in bone marrow, followed by in the peripheral blood, leading to loss of this RNA material in the RBC, forming a most mature RBC which doesn't have any ribosome or nuclear content. So these are the steps in erythropoiesis. So this is the actual picture of peripheral or a bone marrow smear. So this is the early or proerythroblast, which you can see few prominent nucleoli and the basophilic cytoplasm. Early erythroblast, which has got more deep blue cytoplasm compared to proerythroblast. So the next step is intermediate erythroblast, from where there is beginning of hemoglobinization, followed by late erythroblast, reticulocyte, followed by most mature RBC. So we have stain called a supravital stain, which is methylene blue or brilliant crescent blue, which will help in identifying these reticulocytes, which are one step before production of the most mature RBCs. So these RNA material, ribosome RNA material, will be seen within the reticulocyte as a filamentous structure, which will take these stain, methylene blue or brilliant crescent blue. So this help in knowing the percentage of reticulocyte in the peripheral blood. So what is content of the RBC? So content of the RBCs is mainly hemoglobin. So hemoglobin has globin and heme. So globin has hemoglobin has there are three type of hemoglobin which can be seen in adult. So the majority is HbA type, which has alpha and beta type of chain, and minor component is HbF. This is fetal hemoglobin, and HbA2, that is having alpha 2 and delta 2 chain. So in adults, the majority is HbA, minor component is HbA2, and very less amount of HbF. Whereas in newborn, it is predominantly HbF. That is why the terminology F, that is for fetal. And the next majority is HbA, followed by HbA2. So when the normal lifespan of RBC is 120 days. So if the RBCs are having some abnormality or the lifespan is over, they will be getting destroyed in the reticuloendothelial system like a spleen. Okay. So this spleen has cells called as macrophages. So macrophages will engulf or phagocytose these senescent RBCs. They metabolize the content which is there in the RBC. So what are the contents of RBC? Heme and globin. So this globin, which is there in the hemoglobin, will be entering the protein pool. So because globin has amino acid, this will enter the protein pool. Whereas the heme, which has porphyrin and iron. So iron is ferrous. So this will be stored as storage iron as ferritin or hemosiderin, or it can get transferred into the transferrin, which is a form which is bound, which is the transport form of iron. So porphyrin will get metabolized into bilirubin. So the heme will have porphyrin and iron. Iron will go to iron pool, that is ferritin, and the porphyrin will get metabolized initially by heme oxygenase into biliverdin. So this takes place in the blood. So or macrophages. So biliverdin will get converted into or reduced into bilirubin. So this bilirubin which is there in the blood is not water soluble. So they are bound to albumin. So this albumin bound bilirubin will be taken up by the liver, that is hepatic phase. So in the hepatic phase, these bilirubin which is bound to albumin will be released from the albumin and they undergo conjugation to make it more water soluble. So this bilirubin undergoes conjugation by the enzyme called as glucuronil transferase, forming conjugated bilirubin. So this conjugated bilirubin will enter the biliary system, enter the biliary canaliculi, from there to the gallbladder or common bile duct. From there, it enters the intestine. That is intestinal phase. So in the intestine, the conjugated bilirubin will be acted upon by the bacteria in the large intestine, converting this conjugated bilirubin into urobilinogen by the bacterial enzyme. So this urobilinogen, part of it will undergo enterohepatic circulation. That means it enter the hepatic circulation and it will get recycled. Part of it will get absorbed into the blood, which will be entering the circulation followed by kidney. So it will be excreted in the urine as urobilinogen. So part of it will be reduced into stercobilinogen or stercobilin, which will be excreted in the feces. So the color, brownish color to the feces will be given by the stercobilin, which is derived from the bilirubin. So coming to WBCs. So WBCs, we have five type of cells in normal blood, which includes neutrophil, lymphocyte, monocyte, eosinophil, and basophil. So the production of these granulocyte is called as myelopoiesis. So there are similar to RBC, there are steps in synthesis of myelopoiesis. So it begins with myeloblast, which is the most immature cell in the myelopoiesis, which has prominent nucleoli, high NC ratio, and a bluish cytoplasm. So myeloblast is followed by promyelocyte. Promyelocyte will have open chromatin, single distinct nucleoli, and the cytoplasm is more abundant compared to myeloblast, and they have granules in the cytoplasm. Next step is myelocyte. Myelocyte will have more condensed chromatin and they have more cytoplasm. So as they mature, there is condensation of the chromatin and more amount of cytoplasm having more amount of the granules. So the myelocyte will have condensed chromatin with flattening of one end of the nucleus, which give rise to D-shaped nucleus in myelocyte, followed by metamyelocyte, which has indentation at one end of the nucleus, which give rise to kidney-shaped nucleus, and there is granule in the cytoplasm, followed by band form. Band form has more indentation compared to metamyelocyte. Approximately more than 50% of the nuclear indentation can be seen in band form. So at the last, there is production of the most mature cell, either neutrophil or eosinophil. So in neutrophil, we have the lobes. There are multiple lobes which is connected by thick network of nuclear material. So here you can see myeloblast having 2 to 3 prominent nucleoli. Promyelocyte will have single nucleoli. Myelocyte, you can see here there is flattening at one end, giving rise to D shape, followed by metamyelocyte. Metamyelocyte has kidney-shaped nucleus, band form, and the most mature neutrophil. So in lymphopoiesis, we have only three steps: lymphoblast, prolymphocyte, and the mature lymphocyte. So this is how the normal blood smear look like. There are RBCs. RBCs are round to oval in structure. They have a pink cytoplasm because of hemoglobin, and in the central there is a little pallor. So normally it should have central 1/3 of the pallor. So the size of the RBC should be comparable with the lymphocyte. So the size of the RBC will be almost similar to nucleus of a small lymphocyte. So then we have WBC and platelet. Platelet are very small granular structure in the blood. So this is the picture showing all kind of WBC which is seen in the blood. So the most abundant WBC in adult are neutrophil, which has 3 to 5 lobes connected to each other by a narrow strand of nuclear band. They have pale or pale purple cytoplasm having mauve or purple to pink fine granules. So the next cell is lymphocyte. Lymphocytes are small. They have high NC ratio and basophilic cytoplasm and little cleaved in the nucleus. So we have small and large lymphocyte. The most abundant lymphocytes are the small lymphocyte. So that is followed by monocyte. So monocyte has a bluish gray cytoplasm which can have little bit of granule and vacuole. They have a peculiar kidney-shaped nucleus. That is because of the indentation. Next, we have eosinophil. Eosinophil are bilobe, having bilobe nucleus, and they have peculiar orange-red coarse granules. Compared to neutrophil, they have coarse granules. Then comes basophil. So basophil, they are small, but their nucleus is obscured by large basophilic or dark blue cytoplasmic granules. So basically, we cannot appreciate the nucleus in the basophil, but normally they have a S-shaped nucleus. So these are the WBCs. So when we do WBC or DC, normally in adults, the total leukocyte count is around 4,000 to 11,000 per microliter. And in DC, neutrophil accounts for 40 to 70%, lymphocyte 20 to 40%, monocyte 2 to 10%, eosinophil 1 to 6%, and basophils are normally less than 1%. So to summarize, hematopoiesis is a physiologic process of formation of blood cells. So the site in adults is bone marrow, which is seen in various axial skeleton. So the stem cells are the precursor cell, which will lead to differentiation into RBCs, granulocyte like eosinophil, neutrophil, and the basophil, lymphocyte, monocytes, and platelets. These are the references. Thank you.